Yajanik's work from the Pune maternal health cohort has shown that the lean individuals have an increased risk of glucose intolerance and a progressive decline in insulin secretion. Now, coming back to gross malnutrition, I saw my last case of kwashiorkor about 40 years ago, and I haven't seen one, and I don't think most people see kwashiorkor nowadays. But people do see marasmus, which maybe in some parts, in certain rural areas, may be endemic, but may be sporadic more often than not. So kwashiorkor has a survival disadvantage. The mortality rate is almost 50% when it happens. The marasmic ones live longer, and this is the work done by Michael Boyne from Jamaica, which has shown that those with severe acute malnutrition in early life, they have a lower birth weight when compared to the kwashiorkor individuals, number one. On follow-up, when they were given glucose tolerance tests, their insulin secretions were lower and they had a greater tendency for glucose intolerance. These are the marasmic children. Now, interestingly, what has been seen in animal studies, besides having an insulin deficiency, which is probably due to epigenetic changes wherein insulin production is less, thank you very much, there is also a reduction in the effect of GLP-1. And this fits very nicely. We have now unpublished data wherein individuals with type 5 diabetes actually have low GLP-1 levels. And that is really unique because I don't know of a condition or form of diabetes where GLP-1 is grossly deficient. We all talk about treating patients who have, diabetes with GLP-1 analogs, but they're not grossly deficient in GLP-1. Now, here are other animal studies which are done in Korea showing that there's a decline in insulin glucagon levels, and that's at a time perhaps when these are people who are perhaps born in an era when Korea was a very different Korea in the 60s or so. And from Ish Bhatia, once again in Lucknow, that in the initial phase of subclinical malnutrition, there's a surge in insulin and then subsequently hypoinsulinemia occurs. So there's a lot of physiological information showing this. Animal studies showing clearly that in rats, the islet clusters are smaller. They have micro islets and less of the macro islets. So this is a map taken when the WHO classification came about, showing you the distribution of FCPD as well as that of the protein deficient diabetes mellitus. And that is an era when there was not so much technology. Even ultrasounds weren't ubiquitously available, leave alone C-peptides or GAD antibodies, or even for that matter, glucose monitoring being present. The initial study done by Hugh Jones, whom I told you about in Jamaica, was a small number. But more impressive was the number from East Pakistan. This is, I think, Dr. Ibrahim, who was the founder of the Burdham Institute, way back in 1961, showing a significant number of underweight, malnourished individuals who had a form of diabetes which was non-ketotic and quite common. More recently, in the last decade, we have publications from Jamaica, Uganda, and Ethiopia. And I'm going to focus on one study from Uganda, which shows the profile of this phenotypic group. Davis Gibbage, a good friend of mine. You can see that the percentage body fat is around 13.5% in the underweight individuals. It's really low. And the C-peptide levels are also low. And these patients had their GAD antibodies tested, and type 1 diabetes was clearly ruled out. They were eketotic. And though this is a fairly large clinical series. Going back to the work done in All India Institute of Medical Science, and this is Pankaj Shah, must have done this work more than 3 decades back, published in JAPI. I always ask the question, why only JAPI for a clamp study? But maybe the data was kind of prolonged before it got published, showing that in these malnutrition modulated diabetes, there was no evidence of insulin resistance. But of course, they showed a higher insulin requirement, which is a little different. Work done by Mandeep Bajaj, who is Jaspreet Bajaj's son and the former president of the ADA last year, in Thai patients, showing that no evidence of insulin resistance. So there is no insulin resistance shown by 2 clamp studies. And then finally our study in 2022, when it was published, it was a long study. It took a very long time, almost 7 years, taking into account several groups compared. And I'll tell you why it took so long. We selected around 80 patients and we had to probably screen more than 150 to get these patients, did genetic testing in all of them, and we compared type 1, type 2, lean controls, overweight, low BMI individuals and obese individuals as well. We did imaging of the pancreas and all, and ultrasound and an MRI was done in all these patients. They all had body composition studies. So by the time you go through that entire process, many people say, no informed consent, we can't go through the study. So we had quite a few dropouts initially. All of them had a hyperinsulinic euglycemic clamp study. So that's about 80 of them. And this is a very elaborate pancreatic clamp wherein we give glucagon, somatostatin and growth hormone in addition to clamping the glucose for a period of totally 8 to 12 hours. So these are the BMIs, as you can see, the different groups. Now, what was seen was that the insulin levels were low, not as low as type 1, but much lower than the type 2s. This is the pattern of the glucose, as you can see over here. Once again, the pattern of glucose in type 1s, and you can see the patients who have our lean diabetes over here, a much flatter curve compared to the type 1s over here. And this is the hepatic glucose disposal, showing that the hepatic glucose disposal is very different from type 2, and therefore they have lower hepatic glucose disposal, low insulin production, low percentage body fat, and no evidence of peripheral insulin resistance. So it is a different phenotype that we are dealing with over here. This is, And so let me just summarize also the dietary findings. They ubiquitously had low protein intake, and they also had micronutrient deficiencies, particularly that of zinc. And we haven't published that, but the zinc deficiency is pretty profound in these individuals as well. A year later, there was a review in Scientific America talking about this particular article. And this is our more recent article in Physiology, which has been published. So, in summary, it's a disorder with no autoimmune or standard genetic etiology. They have low BMI, poor insulin secretion, hepatic glucose output being low, unlike type 2 diabetes, very low hepatic fat content, percentage body fat very low, and differences in their dietary preferences as well. The Lancet Global Health article will also talk about this, and the IGM review will also come out in the next 1 month. So this is the cartoon in the Lancet Global Health article telling you preconceptional undernutrition, subsequently with overnutrition in the postnatal phase leads to type 2 diabetes. Preconceptional undernutrition and subsequent undernutrition postnatally leads to type 5 diabetes. So that's basically the model that we are following here.